I hope my screen is visible.
Yes, it is, Dr. George.
Esteemed chairpersons, respected teachers, dear students, a warm good morning to you all. It certainly has been a very enlightening morning from the word go, from the much insightful lecture by Dr. Matthew on where prosthodontics is and where it's heading, and chaired by two very revered, I must say, reservoirs of prosthodontic knowledge, Padmanabhan sir and Rangarajan sir, and subsequently Dr. Gopi Chanda, who has gone into the details of prostatistics. And I must add here to the question that Dr. Nikhil Verma had posted to Dr. Gopi, the p-value is very significant since it's definitely part of Gopi's name itself. So on that lighter note, and with this very, very humble beginning, I take this opportunity to share my views on an aspect that deeply touches our lives. The views expressed here are independent and intended for the purpose of education and information. In profound gratitude to my dear teacher at the Manipal College of Dental Sciences, Manipal, Professor Dr. Kashyap Bhargav, who is the reason that led me on a journey to seek the best, to choose the drive to learn and the passion to teach. It certainly was heartening to, as well as nostalgic, to see Sir in some of the very priceless photographs shared by Dr. Ravindra Savti Sir yesterday during his keynote oration. And I fondly remember Sir once again during my lecture this morning. We live in circumstances that call for a rethink of traditional knowledge in dental education. And hence, they need to revisit pedagogy. My presentation is intended to ignite a fresh perspective, as well as to evolve your thought process into this inspirational realm. And I hope that would create a lasting impact in your lives. So let us open our minds. Pedagogy is the art and science, and maybe even the craft of teaching. It is the process of accompanying learners by caring for and about them and bringing learning into life. To view pedagogy from this perspective alone would not honor its historical experience and certainly would fail to connect the crucial areas of theory and practice. Prosthodontics too is an art and science. Traditional dental knowledge has made a serious attempt to address both of these, but I still feel that the latter is overemphasized. Scientific and technical knowledge are indeed important and considered foundational to clinical practice. They alone are not sufficient to teach competencies associated with the art of prosthodontics. Teaching is a complex activity which encompasses more than just delivering education. It offers a joint learning opportunity for both the facilitator and the learner. The key to the learning process lies in eliciting a response that demonstrates understanding. Let's try to piece this together. The origins of pedagogy can be traced back to ancient Greece, with Socrates in the 5th century BC probably being the keystone to what we consider today as modern education. It stems from the Greek word pedagogos, which means child leader, and finds its roots in guiding. More specifically, a pedagogue refers to a teacher. Are education and schooling one and the same? Certainly not. Most often, educators are pushed into schooling, which means to drill learning into people on a plan often drawn up by others. This is famously called as banking, which refers to making deposits of knowledge. As educators, we need to look to acting with people rather than on them. Pedagogy must be meaningful. For this, the content should be delivered effectively to the learner's mind, and it involves planning, delivering, and evaluation of the subject matter, resulting in what we would call behavioral change of the learner through enhancing the cognitive store, which refers to the willingness to acquire knowledge and understand, creating awareness of the affective store, which deals with the moods, the feelings, and the attitudes of the learner, and improving the conative store, which is the desire or the willingness to act. Over the last decade or so, there has been an increase in the complexity of the teaching profession, owing to globalization, rapid technological changes, increasing political and social expectations, as well as the changing dynamics of society. This is a setting that is quite familiar to all of us. However, the difference lies in that our target audience is the adult learner. Lectures are the primary method of conveying information to groups of learners since the Middle Ages. Despite its evolution over the last many centuries, this format of instruction has so far withstood the test of time. Educators rely on a variety of settings, including pre- or post-clinic teaching sessions, as well as morning and noontime teaching schedules. Lecturing has had its share of modern critics, who call it the mysterious process by which the contents of the professor's notebooks are transferred by means of the fountain pen to the pages of the students' notebooks without passing through the minds of either. Hilarious, yet equally thought-provoking. It has been found that adult learner retention rates after traditional lectures are at a dismal 5%. Based on the principles of adult learning theory and the perspectives of relevant cognitive psychological principles, lectures need to be more focused, active, and shorter in duration. It is important for educators and curriculum developers to account how they apply these principles to their learners specifically. When we speak of cognitive psychology, there are two important terms we need to address, which is working memory and interference. Currently, morning or noontime lectures last typically around an hour. Adult learning data suggests that typical learner attention span wanes after about 15 to 20 minutes. After 20 minutes, the lectures become less effective for two reasons, namely working memory and interference. During a lecture, the learner encounters unfamiliar information or probably is exposed to new concepts for the first time. The working memory of the learner processes this input, integrating new data with knowledge that exists within the learner to form long-term memories. This requires active attention as well as the ability to focus on and dynamically manipulate novel or unfamiliar information. As the lecture progresses and more information is received by the learner, there is additional manipulation by the working memory. This impedes the assimilation of information which is still being processed from previous parts of the lecture. And thus, there is a decrease in the capacity to effectively incorporate new information in a meaningful and efficient manner, what we call as interference. I would simply put it as a knowledge traffic jam. Interference therefore makes longer lectures less enjoyable and less effective, and is a major cognitive impediment to knowledge acquisition for all learners. To refresh your thoughts on the perspectives that I just discussed, the traditional lecture format results in low learner retention rates and engagement. To make it maximally effective, the lecture duration must be short. This respects learner limitations and attention spans and helps educators focus on delivering the highest yield content. It must also incorporate the principles of adult learning theory, cognitive psychology, and active learner participation. Adult learning theory is also known as andragogy. Working memory and interference inevitably influence learner engagement, as well as the motivation to listen to and work with new material. It is important as educators to have an awareness of how learner motivation and engagement influences knowledge acquisition. The foundational principles of adult learning and theory emphasize, most importantly, on the applicability of content to a learner's individual goals and objectives, as well as in promoting autonomy in growth and learning. They are highlighted by 6 cardinal learner-related factors. Number 1, the need to know. Adult learners more readily engage with material when they are able to link its relevance to their own goals and objectives. This begins when a learner demonstrates that his existing knowledge is incomplete, what we call as learner dissonance. When a learner, for example, sees a patient in a clinic with conditions or problems discussed during the teaching session, the dissonance created from the learner's knowledge deficit, as well as the need to engage and grapple with the encountered concepts, results in more meaningful learning. Number 2, the learner's self-concept. Every learner has an intrinsic self-concept of the goals and objectives for any given learning experience. A prioritization of that experience will be determined by how well the material discussed would align with the goals that the learner has. If a lecture topic is not compatible with their self-concept, the learner is less likely to prioritize that lecture and less likely to pay attention or put in the cognitive work of deeply considering the content being presented. Number 3, the role of learners' experiences. As when a learner comes to a lecture, they come with a pre-existing fund of knowledge about a given topic, which is based on their past educational exposure and clinical experience, as well as their knowledge deficits. Educators must therefore demonstrate respect for learners when they inquire what they know about a topic in advance. For example, through a pre-lecture email that could address on areas that the learners may think are deficits in their knowledge about a proposed topic. This allows the educator to adapt the content of the lecture to address this deficit in the light of the learner's prior experiences. Number 4, the readiness to learn. This would depend on where they are in training. We know that learners are at different stages, having different levels of readiness to encounter more or less new or advanced material. For example, an intern would be more keen to be sensitized to the foundational aspects of a technique, whereas a postgraduate student would be mind ready to look at the advancements of a similar technique. The orientation to learning is equally important for the adult learner. They must feel that the material is applicable and relevant to their immediate situation for them to engage with what is being discussed. Learners would engage in a lecture on the management of a specific treatment modality, for example, maxillofacial prosthetics, if they are in a specific rotating posting during the discussion topic. The motivation to learn is the awareness of the internal motivations that drive learner behavior, and this can help maximize attention and interest in a topic. These remain the 6 cardinal principles I just mentioned earlier. It is important to bring theory to practice, and that is possible when you bridge the gap between the principles of adult learning theory and cognitive psychology with the day-to-day educational practice. This remains a true challenge. Adult learning theory provides a framework for curricular planning and content inclusion. Lectures are required to be more effective, for which it is important to have implementable, practical, and point-of-learning strategies incorporated into them. A combination of rational lecture organization, ensuring active learner participation, and shorter teaching session durations is probably the right approach to achieving this goal. Rational lecture organization directly addresses the issues of limited working memory and interference, which we have just spoken about in learners. This would help a learner to learn better, as well as knowing the information to organize lectures in a deliberate manner would add value to the educator's involvement in the process. It therefore aligns the principles of adult learning theory and cognitive psychology for a more effective educational experience. A rational lecture design takes into account a need to identify how learners are motivated to understand their current knowledge about a problem or a concept. It promotes dissonance as well as internally motivated engagement. It is equally critical to acknowledge how learners assimilate and use new information. The how and why of adult learning, in short, is as important as the what. Active learner participation identifies opportunities for engagement and interactivity during lectures, and therefore enhances content retention and relevancy. Adult learning data have provided compelling evidence through numerous positive studies involving learners at different levels and in many different contexts, which go to show the effectiveness of active learning as against passive lecturing. A recent meta-analysis of 225 studies assessed these outcomes with regards to traditional lecturing and active learning techniques. It was found that the student performance in examinations showed an average increase in scores of approximately 6% improvement when the classes incorporated active learning. Traditional lectures were associated with a 1.5-fold increase in the risk of failing, which supports the results that application and interaction increase learner engagement and knowledge retention. Active learner participation offers the opportunity to apply knowledge, providing the learner time to relate to new or unfamiliar information and thus bringing it together with knowledge that they already have. There are several active teaching strategies that as educators we can use to make our lectures active. Peer instruction is probably one, where the lecture material can be broken into short segments and interspersing these segments with conceptual questions that learners answer first on their own. A subsequent discussion with 3 to 4 colleagues could then help to develop a group consensus answer. Active is another method where A would be to assemble the learners into small groups, C to convey 3 to 5 learning points, T to teach a limited amount of content, I inquire about how the content applies to patient management, and E to explain answer choices. We could even create bus groups by dividing a large group of learners into pairs or small groups at the beginning of a lecture. These groups collaboratively answer questions posed throughout the lecture. The audience response system helps to assess individual response to questions in a real time through technology or through manual responses. You could even assign in-class writing after a lecture session, where the learner is asked to write a review about the most interesting things they learned during the lecture. A review of their writings would help to assess the effectiveness of the lecture. And finally, the think, pair, share technique, which would divide learners into pairs, asking them to think about questions posed during the lecture, to discuss these questions in pairs, and eventually share their consensus answer with the group. To illustrate an hour-long teaching session, which we normally engage in, I have a diagrammatic representation here. And to ensure that this teaching session becomes more engaging for the learner and certainly more effective, you could intersperse content delivery with the active learning strategies, the 6 of them that I just mentioned, between various stages of content delivery. And therefore, you would get a much more meaningful outcome to your lecture. A shorter teaching session is definitely more effective. To illustrate this, let me take the example of a teaching session on the Facebook. A comprehensive hour-long PowerPoint lecture on the intricacies of a Facebook would certainly not gain the merit of a 15-minute primer on the fundamentals, followed by a 15-minute interactive teaching session, which includes a chair-side discussion on the patient. It therefore results in higher learner satisfaction, more meaningful dissonance, conceptual understanding, and knowledge retention. The hour-long lecture may certainly cover more content and expose as well the learner to more information. But you must remember that you tend to fall prey to the fallacy of knowing, which is the assumption that if someone is exposed to a piece of information, then they must immediately learn it. I know the student delegates listening to this discussion would wonder, what's in this for them? The MDS course regulations require students to fulfill proficiency during their period of training in teaching skills through undergraduate teaching programs in the form of lectures or group discussions. To achieve this, a model checklist has been provided that contains 13 parameters, which I have put together in 5 sections that serve as a recipe that combines all that is required to make your lecture more meaningful. The first being the communication of the purpose of your lecture, as well as evoking an audience interest in the subject. The second being an introduction and a logical sequence of ideas. The third, the use of practical examples, illustrations, audiovisual aids appropriately, as well as a speaking style that engages the mind of the learner. Fourthly, an attempt for audience participation by asking questions, answering them, as well as in building a rapport with the audience. And finally, a summary of the main points so that your talk is more effective. I have added a 14th parameter here, which is time management, and I think that is very critical. As educators, we have multiple roles and responsibilities, and this mind map explains it the best. We are not just professionals, we are also facilitators, builders, protectors, and certainly must remain lifelong learners. Our learners represent diverse cultures and backgrounds, learning styles, social and emotional needs, life experiences, and abilities and skills, just like a pack of pencils. It is important to rethink our assumptions and transition to a shorter, more interactive lecture. This frame shift is certainly the need of the hour for educators to think about when it comes to curricular development, and it would necessitate identification and inclusion of the highest yield topics for any given group of learners. Faculty development should focus on incorporating proven active learning techniques into teaching sessions. There have always been arguments against modifying lectures, and particularly concerns about shortening their duration. It is always our desire to expose learners to as much core content as possible. We assume that maximizing content delivery necessitates longer lectures. I do understand that curriculum developers have a very strong desire to somehow fit it all in, but such an impulse is ultimately going to be counterproductive. Developing high-yield effective sessions should therefore be a priority by utilizing the principles of adult learning theory and shorter active construction, which can help us to develop and deliver more successful lectures. The pedagogical process should be applicable in any learning environment, whether it be face-to-face, virtually, or through e-learning. It is important to prepare the content by establishing what the learners need to learn. It is equally important to present and deliver it according to the learning styles of the individuals we are working with. This could be achieved by building a cognitive process that allows us to train or teach at the pace and in the style our learners take in information, with the intention of making our exercise a learner-centric one.
We are running out of time. Can we conclude, sir?
Absolutely. It is important to evaluate how successful we have been by assessing the value the learners have received. As I would summarize, the principles of adult learning should inform rational lecture and curriculum design. There is a need for dissonance, which offers an important perspective on how we learn and how it can be applicable to lecture content and construction. Working memory and interference influence attention and engagement for all learners, especially dental learners, who have extensive competing clinical obligations. By making lectures shorter, we can certainly increase their efficacy. As more becomes known about adult learning and theory and what constitutes optimal learning, we owe it to our students and their patients to apply these principles to create more effective learners through our lectures. Certainly, breaking old habits is hard, but by incorporating active learning and adult learning theory into lectures are critical steps for improving their educational value. A good teacher can inspire hope, ignite the imagination, and instill a love of learning. Professional education is not just education for understanding alone. It is a preparation for accomplished and responsible practice in the service of others, which is good work. As professionals, we must learn abundant amounts of theory and vast bodies of knowledge so that we may come to understand in order to act, and we must act in order to serve. As a good teacher, we must aspire to provide an environment where both the learner and learning are valued. And we can achieve this through the formation of strong, positive relationships with our students. As a final thought and in conclusion, I see myself as a teacher who is passionate about learning and believe that a love of learning can be instilled in our students through creative planning and the use of effective pedagogy that engages all learners. I thank the Indian Prosthodontic Society in humble gratitude to the hosts of the 23rd IPS PG Convention at Jaipur, Rajasthan, as well as to you, my esteemed audience, for the generosity of your patient attention. My humble gratitude and